I want to welcome everyone to our July 30th, 2020 regular midday Rotary Rotary meeting. Again on Zoom as we continue to deal with the coronavirus debacle that we're dealing with, and hopefully everybody is doing well and staying safe in these crazy times. We have Julie Brock is going to lead us in the four-way test, and as we've been doing, for those who haven't dialed in for a while, we're going to have Julie read the first, the four-way test items each individually. So she'll read that, and then we'll repeat after her. So Julie, it's all yours.
All right. Well, welcome, Rotarians. The four-way test of the things we think, say, or do. Is it the truth?
Is it the truth?
Is it fair to all concerned?
Is it fair to all?
Fair to all concerned.
Will it build goodwill and better friendships?
Will it build goodwill and better friendships?
Will it be beneficial to all concerned?
Will it be
beneficial to all concerned?
Thank you, Julie.
You bet.
All right. Has Carol returned yet?
Yes.
Okay. Well, Carol, I don't see her on my screen. Oh, there she is.
Yeah, I'm hiding up here.
You would like to lead us in a reflection?
Yes, this may be the shortest reflection we've ever had, but given where we are with the pandemic, etc., it just made good sense. It's something that I got from the St. Paul Pioneer Press. They do something called bulletin board, and people just send little things in for that. This is called Patience and Faith. Patience and faith are friends. They live in the same neighborhood. Patience is good at waiting, even when waiting is hard. Faith believes in goodness, even when it's difficult to see. They each have a garden filled with flowers and vegetables. When Patience wonders if those perennials will really come back, Faith is there to reassure her. And when Faith wonders, will there ever be a ripe tomato on that plant, Patience reminds her that good things take time. Patience and faith can make it through the worst of times.
Very good.
End of comment.
Amen.
Very appropriate for
I thought it was too. I thought it was too.
Thank you. Well, I'd like to
What do we?
I can't hear you, Chris.
I'm sorry. Okay, again, I'd like to welcome everybody, including guests, to our meeting. If you are a visiting guest, please unmute yourself and introduce yourself to the members of our club.
Hi there, this is Joe with Winona State University, Rochester, and we have Mariana Hensley today from our office joining in as a guest. So welcome, Mariana, and thanks for joining us.
Very good. Thank you, Joe. And welcome, Mariana. In looking at very quickly here, the moccasin flower, I wanted to highlight this past week since our last meeting. We've had several birthdays. Mark Murch on July 25th, Lee Johnson on the 26th, and then today a big group, including Colin Aldis, congratulations Colin, Laurie Carroll, Mark Ostrom, and Steve Sponsel. So happy birthday to all of you, and unless you want to lead us in happy birthday, Colin, we'll leave it at that. And I see tomorrow is Betty Devine's birthday as well, so that'll fill out this week. One other item on the anniversaries that I think is kind of interesting, as I see Janine Gangnes, our program today, is going to celebrate by being our program today. She's joined 5 years ago, so thank you, Janine. So programs or events over the next week. Rotary After Hours with social distancing will be held on Thursday, next Thursday, August 6th, 5:30 to 6:30. Audrey Betcher, Suzanne Dennison, Carol Weigel, and Bill Wichter have agreed to be our August hosts. So if you would like to sign up for one of these events, Rotarians and guests will gather in groups of 8 outdoors to reduce the risk of COVID transmission. Attendees should plan to provide their own food and beverage if desired. Masks are encouraged. Social distancing will be followed. Please sign up at the Rotary website calendar through the link in the next Moccasin Flower, or by calling or emailing Elizabeth at the Rotary office. Please note, however, the Rotary office will be closed tomorrow, back in operation on Monday. We have a Rotary board meeting, our annual or our monthly board meeting next Wednesday, 7 a.m. versus via Zoom. So we always look forward to those early morning meetings. The Rotary golf outing, save the date announcement. I guess we may be having some problems there, and that Kathy Lassard has resigned as not being comfortable organizing this event. So stay tuned for further developments. I think we still have it on our agenda for September 16th. And of course, there'll be a short program prior to playing golf. So we'll have to discuss that over the next week or so and update everybody next week on the situation. The one other item I wanted to mention, I think I talked about it a little bit as I came on here. There's a Rotary district, one of the regular Friday meetings of the St. Paul Sunrise Rotarian Club has a presentation by Anthony Galloway, Executive Director of Arts and U.S. Galloway. He's been featured on NPR and through various publications regarding a presentation on racism and the history of and development of racism. If you're interested in that, I believe that notice went out to all of the district Rotarians, but I will forward the sign up for Elizabeth to pass along to everybody. And you need to register for it. It is at 9 o'clock tomorrow morning. So if you're interested in listening in on that, you want to keep an eye on your communication from Elizabeth. So have I missed anything? I guess we're ready to do our program, I guess. I'd like to, I'm pleased to introduce Janine Gangnes as the Associate Vice President, serving as the CEO responsible for leading WSU Rochester Branch Campus and the Dean of the School of Graduate Studies. Janine has been honored to lead a strong team of professional staff, faculty, and students through her career. She's a results-driven visionary leader with budget acumen and a talent-focused team builder. Janine has done significant research on community-built environments, community wealth, community health, business engagement in higher education, and higher education partnerships. Prior to coming to Winona State University, Gangnes was the founding dean of the Bemidji School of Nursing, a joint venture of Bemidji State University and Northwest Technical College. She graduated from the University of North Dakota in 92, 02, and 07, which is interesting, and holds a Master's of Science degree and a PhD in nursing. So Janine, welcome to the presentation, and it's all yours.
Thank you so much. Boy, it's an honor to be with all the Rotarians today. And I'm just going to do some technical setup here. I will tell you that Donna asked me to speak a while ago, and what I knew then and what I know now are two different things, and what I'll know in a year from now will be something else about this topic. So Winona State is getting ready to start up this fall. We have been doing some work this summer, and so I'm going to try to give you an overview and Please know that this information changes day by day. In fact, I updated some of these slides this morning because of Department of Health updates in the last week. So science is happening fast. I think we heard that last week. We'll see if I can advance here. So I think we're focusing this year really on being flexible and understanding that our students that are coming in that haven't had a college experience before are going to have a unique college experience, and it will not be the experience we had, but it'll be the experience that they can share with their friends in the future and say, no, that was the year that I was a freshman. And so I'm hoping that we can make it as safe as possible for them to enjoy not only learning, but also each other, and stay safe and healthy in the process. That's our goal for opening up. We do have a variety of face-to-face courses, and we're doing some hybrid as well as online. So we're doing just a lot of mix of activities. We are getting ready for students. We've been working hard all summer, actually since March. You know, we have just been working on this, what we knew then and how we pivoted, and now how we can prepare better for the long run for our students. And then we'll have a question period at the end. As we look at being ready for our students and getting ready, I would say that Winona State is very fortunate to have a technology, deep technology infrastructure we have for a long time. Most of our programs have the eWarrior program, which includes a laptop, and so students, when we pivoted in March, they had a lot of the infrastructure to move smoothly without having some of the challenges that some schools have had. And so as we look at now being able to plan a little bit more, I was thinking when Carol was speaking, patience, faith, and planning. I would add planning to the list. That is where we're at. We are in between the planning and implementation place. This is our infrastructure right now for COVID, and specifically around work groups and making sure that we have a large group of individuals who are experts in their field, really focusing on a variety of areas. So the information I'm sharing today is sort of a compilation of lots of people's work and lots of committee work. And so we see fall instruction has been a strong area for us for a very long time. We're looking at coming back to campus and what does that mean. We're hoping to do some health promotion and education. So if you think about, and this is not exactly the same at all, but if you think about how we change behaviors with stopping smoking on campus, we're hoping to change behaviors around wearing your mask, washing your hands, and staying at a distance. So those are some things we're hoping for, some social change and cultural change around those topics. I work very closely with the testing, isolation, and contact tracing group. And then, as you can imagine, residential life and food services and athletics sort of have their own mix of challenges as we move forward into the fall. So if you're looking for what we're sharing with our students, this is sort of the returning to campus eight tips. And we're really hoping folks are thinking about when they come back to campus, how can they think about other things, an expanded list of back to school supplies than they have had in the past. So you might have had a coffee machine and a small refrigerator in the past, but now you probably also need to think about safety issues. We're certainly providing a mask to students, but those masks need to be washed, and you should probably have a backup supply. You'll want to have some of your own cleaning things, and you'll also want to have maybe an expanded shopping list for what if I do get sick, but I'm not sick enough to go home. Then what are some of the things you should bring? So you can imagine the messages we're sending to our students are much different than they used to be. Other institutions are sending information to their students coming to campus that say, pack light, we don't know how long we're gonna be able to be in session, and just be prepared for a pivot at any moment. And I think that's a fair message. We will be, as a system, we will be having everyone, faculty, staff, and students do a self-assessment at the start of every day that they're on campus. So because we have several students that are in other settings, we will follow those rules. So if you're in a clinical setting or at a hospital, you'll follow the hospital's rules. If you're at a public school and you're student teaching, you'll follow those rules. But in MnSTATE, you'll be expected to fill out a self-assessment every day. And then it's sort of a green light, red light. Based on the information you provide, it will give you a thumbs up, head to class, or don't go to class and contact your student health or your personal care provider. So we're being realistic about where we're at, and knowing that we're kind of stepping into this at a time where we're not sure that the peak has happened, but we want to be prepared and keep folks safe. Winona State has been really focused on the Ready for You and campaign, and we're looking at a lot of different options. So we know that there's not just one answer, and that as we share information out, we're keeping our communication lines open, updating our website with COVID information and what's important right now. So you're going to notice we're going to be inviting parents and new students in for forums and saying, you know, let's go through some basic information and what are some questions you have. Those are going to be essential, especially on the residential campus. And we're also going to be looking at just expanding our frequently asked questions areas. So for us, we know that the information is changing, and we also know that there's certain things that we believe we know right now that we can mitigate at least the transmission of COVID between our students and our staff and our faculty. So we're focused on personal health and safety. I think that's number one. The best way to navigate a pandemic is to make sure we get through it and people are alive and well to talk about it later. So we are focused on health and safety. So as you think about some of the self-responsibility, this is a virus where there are portions of it that we do have some level of control in how we can protect our community. And so we have developed an Ask a Nurse line for folks to call in, students to call in if they have questions that they just aren't sure of. And so that is being staffed, heavily staffed right now. And we anticipate as we start up, we'll have more and more questions. The recommendations, some of these recommendations aren't new, but they're certainly important. Wash your hands and wash them correctly. Dr. Poland talked about that. He had a great skit that he has on YouTube with Jimmy Kimmel. And yes, washing your hands, it still comes back to that. Wash your hands, wear your masks. Face masks are really proving to be the one thing that we're finding if you look at all the different sources, we follow MDH and CDC guidelines, and we're finding that wearing masks really does make a difference. Limiting how close you are to people, and right now the rule is 6 feet. Avoiding large gatherings, I think that's important as well. And so as we think about this and how we can do activities or engage with people, but making sure it's just on a smaller scale and on a safer, we can decrease the risk of transmission. It's one of those things where there's a range of risk, and we're just trying to be as honest as we can to our students and our employees about that. So this is an example of some of the work we're doing so that we can make sure employees and students are aware of what's the range of risk, and knowing that that if you have, and we have this for lots of different topics, but this just happens to be around access to food, but there are several things that you can do to be more safe, and there's other things that would be more risky. And so how do we make decisions based on on your personal choices that will make you safer? And this doesn't mean that if you do everything in the safest category, you're never going to be exposed. And it doesn't mean if you're in the highest risk category that you will definitely get it. It's just information for everyone to consider as they're making personal choices. And we're hoping that it will actually decrease the chances of transmission. So we are aware, now this was updated recently because MDH just updated their recommendations. We are aware that we will, and we already have had COVID cases within our faculty, staff, and students. And so basically the question becomes, what do I do if I've been in contact with someone, or what do I do if I am COVID positive? And so as the information updates, it's like, have you been tested? Have you tested positive? Are you close to someone? And so what you can see here is it gives you a wide range of, if it was someone who tested positive and you know they were positive, then you also need to quarantine for 14 days. And since the last contact, so you may have been in contact with that person 4 days ago, so then you still need to be in quarantine for 10 more days. And you need to get tested. And the tricky thing about testing right now is if you're not internal to an organization or have surgery coming up or something like that, it's the MDH backlog is pretty significant. We're looking right now at between 5 and 7 days to get a result back, which is not conducive to managing a pandemic. So we're really encouraging folks to be cautious and make sure that they do some self-isolation if they feel they've been in contact or they're experiencing symptoms. I will say this, that if you ask my opinion, I'm concerned about this, but I'm even more concerned about the asymptomatic positives that right now MDH is still not recommending that we test a broad group that is asymptomatic. So that's very troublesome, because those are the folks that are completely believe they're not spreading, and they are spreading the virus. So that's concerning. That'll always be concerning. This talks about symptoms and contact and really getting tested. Winona State does have testing kits. We were sent 500 testing kits from MDH, and Mayo has recently released 100 test kits every 2 weeks. And they said, let us know if you need more. And quite frankly, if we need more, it's going to be pretty tough to run our business. And so, so we do have access to test kits, but again, it is the turnaround time to get the test results. And I'm always cautious about this, because I personally have friends and family who were tested, but they were internal to like Mayo. They were prepping for surgery, and then you get your results back in a couple hours, right? And so I think the real answer is you can get test results back in a couple hours, but the labs just aren't, do not have that level of capacity right now so that they're turning around everything in that amount of time. So that means folks are probably still spreading the virus for a while before they get their results back. So we're also looking at what do I do if I'm experiencing symptoms. And so we have been talking to our student population and our employees. Over this summer, we've had some experience with community spread and how we can isolate and quarantine. So if you think about somebody working with someone closely, like if you are doing facilities and you're, it's beautiful outside, but people are doing weeding in the gardens. And if you've been to Winona State, it is gorgeous, beautiful place to be. Then if you're with someone and you're doing that close contact work, if one person receives a positive result, then everybody with them also needs to quarantine for this recommended amount of time. So you can imagine how quickly this escalates from one person to multiple people. So we're being super cautious about how we're bringing back staff and students and making sure we have certain pods of people that don't necessarily engage with others, because we don't want people to have like an entire office wiped out, or and they might not even be positive, but somebody in their office was, so that takes them out for 2 weeks. So this is a lot of planning and a lot of caution, and we are still following the governor's guidelines on if you can work from home, you will. I would say most of the folks that I'm working with have an occasional time they need to come in, or for me, I've met with students and faculty, and we've mostly been able to meet outside. Thank God for the good weather, right? But I would say that this is going to become more and more challenging as the weather starts to get a little chillier. So then let's think about our students, and really this has been the bulk of our planning for 3-4 months here. How do we get ready to pivot, and how do we get ready to open? So the key here is flexibility, making sure that when you're developing your course and planning that you have options for online if that's possible. But if you're meeting face-to-face, or maybe you're meeting a little face-to-face and the rest online, that you're able to pivot to an online atmosphere. Now, as you can imagine, that's impossible for some areas. So it's very difficult for athletic training to reduce a dislocated joint or something like that. You just can't do that virtually. It doesn't work very well. And our nursing and our social work and our teacher education, some of those areas are very challenging to do only virtually. So there are some things that really need to be done in a lab. Chemistry is limited with their lab opportunities because what you can do in your home versus what we can manufacture in a lab are very different. So we're trying to be very intentional about doing the things that need to be done in a lab or on campus, and making sure that those folks are super safe when they're doing that. They're distanced, they're masked. In some cases, they have masks and they have face shields, because that does actually replicate what's happening in the real world where they will be working. So overall at Winona State, we are, this fall, we're at about 42% online and 25% hybrid and about 11% face-to-face. So we have a variety of opportunities. In Rochester, Our programs were at 69% online, 18% hybrid, and some mostly online. That means they're also meeting maybe a weekend, or they're splitting students up so they can engage and do their test out for their skills. And then we have about 4% face-to-face, and some of those lecture lab combinations, we only have 2%. So that's where we are. And we usually run about, last year's numbers were, I think we had about 600 or so graduate students, and probably about the same number undergraduate students. So if you're trying to get a sense of what that number means. We're working really closely with faculty. I would say that you can see really it's a public facing website, the Keep On Teaching website that we're using at Winona State. We're working closely with faculty to make sure that they have syllabus language that talks about masking is important, distancing is important, and those things are required in the classroom. We're also doing some templates for some of those folks so that they can kind of see if they haven't imagined their course in this atmosphere, now they can. And really doing a lot of one-on-one work with these folks. And so I would say that overall, this team has been working like 24/7 for 3 months. So this has been a hard working group like everybody is, but they're really developing some great guidelines for faculty. I'll call it the safety net, which is great. This is this is an example of their website that's public facing, and it talks about mitigating virus transmission during class meetings. And so we're being really specific about that and finding ways that we can support our faculty. This is for those, some folks that are actually teaching online and some folks who haven't ever taught online, and how to make that course personal and really looking at ways that we can help them transition if they need to. And so in the spring, they needed to super fast. So that's less planful, it's more reactionary because it needed to be. Now over the summer, we've really had an opportunity to say, how do you engage with students and make it a community? And how do you extend a helping hand? How do you share with folks what your support is? And we've been very intentional in Rochester about identifying multiple sources of support, sending it to students, and keeping probably every couple weeks now, we've just started communicating with students so that they are hearing what we're thinking and they have an opportunity to ask questions. So I think as we get closer to the semester, then those questions will start to arise, but we really want them to feel connected and cared for. So if you're wondering, what does it look like? Well, I'll tell you, all of our classroom spaces, we have needed to revamp what they have for room. So it might be this room used to be able to support 60 people. Well, now it can support 20. And it really varies based on if the tables are bolted to the floor, that's hard to adjust. And if they're not, then we can adjust it more. So as we have been going forward, our facilities folks, so we're working closely with RCTC in Rochester, and then we have some space downtown. We have been updating the class list. So right now, all of our classes are in a classroom, and they have the appropriate amount of space between them and the number of students. But you can imagine what a nightmare this was for schedulers and our facilities folks. But we're getting there, so I'm very excited about that. We're also looking at traffic flow. So anyone who's been at Mayo or pretty much any healthcare facility, you can see that there's traffic flow. And the way we don't want a lot of cross traffic as they go through the hallways, because that just does not allow for the 6 foot distance. So or go to the grocery store. We're trying to be a little more obvious than some grocery stores about this is the direction. But we're working hard on that signage now. So I'm anticipating in the next 2 weeks, we'll have all of our signage up. Informal learning spaces, you know, those are the spaces that aren't the classroom. We have a bit less control there. So these are the places like you walk in and there's a bunch of couches and that's where students hang out. And so we're looking at those spaces and trying to identify how to space out and remove furniture, how to encourage folks to not move the furniture back, putting a lot of signage up, and just really working hard to do that. We have had a couple pilot studies here, I will tell you. So our library has been open all summer, and our Broadway location has been accessible to students all summer. And so we've had students that are really quite respectful of the rules. So we're fortunate there. And I would say the other thing about these groups is if you think about laptop distribution, because we're a laptop institution, we've been doing that for a couple weeks now, and we really have had, everyone has maintained distance and they've maintained their masks. So I have to do a big shout out to those folks who have really been working hard to make sure they can come back to college next year or this fall. So if you're wondering what are the indicators or what's going to be the issues that we're going to have to keep an eye on to identify, you know, whether we're moving forward strong or we need to pull back a little more. And those things are listed. Any one of these areas could actually take down the pyramid. So if all of a sudden we have lots of positive tests and deaths in the community and surrounding community, that will impact us. If we have folks that we're really not able to protect the vulnerable students and employees, that will be a problem. And thinking about percentage of cases linked to known cases, those are, you know, so each one of these, so let's say we run out of supplies. Well, we can't really safely bring folks back if we run out of supplies. So these are all the things we're considering, and we have a matrix to identify when the pullback has to happen, where we do it more carefully, versus when the go online step is. So we're being very cautious because, again, we're trying to be very careful about people's health, and we're hoping we can navigate through this crazy pandemic together. So with that, I'm going to just leave this up and see if anyone from the group has questions.
So thank you, Janine. If you would go to the chat section and ask the question, then I can forward that on or read that out loud for everybody. So while we're waiting for that, I would have a question to share. Would be, you know, obviously education and online classes and those type of things are really critical to. You know, it is really critical to have a teacher or someone that actually is leading the class, and so it would seem like that's a real point of a real problem area, because you might have what 15 or 20 or 30 students listening in and online, but if the teacher isn't able to perform, then you've got a real problem. And so are you working with a backup system in that regard?
So what we've been doing is really doing one-on-one and small group sessions with faculty on how to manage those situations, and being able to really become expert in the management of both the technology and the classroom information. And so that happens in a lot of different ways. So even in this meeting, if you think about when we break into small groups, and so being able to be an effective question poser so that folks can go into those small groups and then come back and share their information. So I think that that has been, we have a teaching and learning center with instructional designers that honestly I cannot imagine doing this work without. And so they really address that the best by making sure that faculty have those skills. Yeah.
All right, question from Christine Erke. Thank you for the great information. As a parent of a WSU freshman, this puts my mind at ease. Can you talk a little bit about the hybrid teaching option? From what I understand, students can choose to attend class virtually or in person.
Right, so we're learning new words in this pandemic, and one of them is high flex. And so high flex classes happen in a way that the classroom, you can attend in the classroom and you can be online and attend the class. And so it has been just so interesting the way we have been able to engage students in that way. So far, we've had a lot of luck, Christine, with having sort of a high flex setting. And some programs have actually been doing this for a long time, but I think our technology is better now than it used to be. And so, and plus, let's face it, we all have become Zoom experts in the last 2 months. And where before it was just sort of an add-on, I would say that we're much better at doing that now. And so students do have the right to choose, and some students really want to feel the energy of the classroom, and so we have rules so that they stay safe. And other students may either live with someone or they themselves may have some sort of comorbidity or chronic illness. And so it's really not advised for them to be in a classroom or near anyone, but we still want them to participate. So that is actually why we're doing, having some of those high flex options. Did that answer your question, Christine?
I think so, yes. So there's a lot to this, obviously.
Yeah.
John Woodruff asked, don't you think it's really a little too early to go back? As an example, I see high school track students in running groups, no 6-foot masks. Where are the coaches? That's obviously not your problem, but it's the young I'm invincible kind of mentality, I suppose, and the athletic groups. So what do you have to say about that?
Yeah, so the athletic group, we just got notice that our conference is delaying. And so I think, I'm not sure what the date is. I don't know why I have triggered in my head October 1st, but that might be wrong, so don't quote me on it. But we have delayed the start, which is important. We have not allowed practice yet at Winona State. Our sister institutions in the Minnesota State system have, and in every case, they have had an outbreak of COVID. And so it is just quite frightening, to be honest with you. And so I'm glad they delayed, and they'll be able to reassess, because that's the deal with this virus, is every single day we find out something else. So I think I have a question from Philip, who asked what percentage of usual students do you have returning? So we have, I can tell you how many we don't have returning. We have about 18% that aren't returning, that have opted to do all online. And so they're returning to us as Winona State, but they're not returning to campus. And I will also tell you our residence halls are full. And this year we are doing, everybody gets to have their own room at a shared room price, so that's a deal. And we're just trying to make sure that they stay as safe as they can be. We have not had any summer melts, that's what we call it in higher ed. We've had no summer melts for students wanting to stay on in our residential halls. So the residential halls are full, but they're at a single room capacity.
Yeah, that answers the question. My granddaughter is starting at Minnesota State, Mankato, and same issue. She hasn't really been notified, though. It's kind of interesting about I'm assuming they're single rooms. Every dorm will have to be a single room dorm, I would assume.
Yeah, Mankato is also doing individual, like meeting with students and their parents, and they've had a couple sessions already. So let me see, Barry has a question. Curious as to how students will be graded for online classes, open book tests versus the usual closed book and classroom, for example. Oh, yeah, so it depends on the class and what the learning outcomes are. Sometimes it's about doing papers, so that would be no different, or doing presentations, which strangely enough is also not different. But as far as tests, we are working as a system with a proctoring group. And so there are online proctors that are both digital and people managed. And so we are working with our system on that. Some people do open book tests. However, the trick to an open book test, because I've given these, is actually timing them, which forces you to know your information because you can't look up every answer. And so that would be timing is how that works. And so there are some closed book ones, and that we're using a proctoring system for, electronic proctoring system. And let's see, Christine Beach, my friend.
Yep.
Is there a plan for education majors who need to be in the classroom? Yes. Mm-hmm. Yeah, so we did finish out the year with students finishing their student teaching. So one of the benefits to being young and knowing all this technology is they've really, it's been a give and take between the student and their mentor, their pedagogical mentor, and being able to transition the learning outcomes into an online environment. I think I've interviewed a few students that are in the K-12 system on how they have been managing that teaching experience and teaching students as a student themselves. And so really the way they've been doing that is working closely with their classroom mentor to help them reimagine the way their class is being taught in achieving the outcomes. So this may be one of those times where there's a lot of teaching of each other, right? because this group of students right now, they're just so technologically savvy.
Yeah.
So Audrey has, she provided some information on Mankato. I guess they're doing roommates. We're not doing roommates in Winona.
On a positive note, the impression I have is that there's a significant amount of improvement now because of this unfortunate situation in using technology to be a way for students to learn. And if there is some sort of a positive spin on this, assuming we get through it without a more catastrophic loss of life and so on and so forth, aren't we really at a point where we're really improving the technology capabilities of our younger people coming in, and it'll have an impact on business and government and all kinds, and obviously education as well. So just a thought. I don't know. Do you agree with that?
Yeah, so last week when Dr. Poland said we're seeing fast science, science is, and research is moving fast, I would say that is also true for the online and technology savvy folks. I think even in adults, like I think about what I didn't know 6 months ago, and I spend a lot of time on video conferences. And so I think that that not that there's something good about this pandemic, but there will be different outcomes. And I'm always very cautious about what is happening with individuals who are experiencing something for the first time, like their freshman year. They're not going to have our freshman year. They're going to have their own special freshman year. And so it's my opinion that these students will be treated like the first cohort of a program where they're pretty special to us. We're always going to remember them because we engaged with them in a different way, and we were very focused on their health and making sure their well-being was really at its best.
I'm not aware if the governor has come out with his guidelines or the state's guidelines yet on education. Has that been announced yet today? Or is that this afternoon sometime?
2 p.m. Yeah.
Okay. So do you think that will have any impact on how you're dealing with things?
Sure it will. It'll impact it depending on what it is, if it's across the system or if it's a district by district choice. But I would say that there's a couple areas that are going to be seriously impact for us. One is our teacher education program. Of course, that makes a difference, right? And how they will engage with their mentors. And so we have a significant number of students that are in the school districts. And then the other area I would say is our employees. And so if we have students that are at home versus going to school, that changes the way you work. I have a colleague who said, well, if the kids aren't going back, I'm going to need to work online from home because 10 and 12-year-old boys don't necessarily self-direct very well. And I cannot argue with that.
Girls, it's not just boys.
I would say 10 and 12-year-olds in general. That's right. In her case, she has boys, so she used them as an example. So I would say, yeah, it is going to impact us in both workforce and teaching learning experiences.
I see Allie asked the question, is the Minnesota state system providing guidance across the system? So coordinated.
Yeah, I would say yes and no. There's certain things that are coming from the system, like that app that I talked about that everybody needs to check in. That is going to be a system level project. And then there's other things that like how we decide how much we decide to go online or in person. And at some point that might shift. They might say, listen, it's just gotten too crazy across the state. Everybody's going online. But that's not what they've said so far. And the system is incredibly diverse. And so if you think about the work of RCTC and other areas that have technical colleges, it's very challenging to do some of those programs online. And so they are allowing quite a bit of flexibility in how this work gets done. But they are providing nice policy support and also, I would say, directional as far as how we can support our faculty, staff, and students in training. So we all have to do a training before we come back that they've developed. So they're doing that kind of really system-wide and advocating, of course, with the legislature, letting them know just how this is impacting each of the schools.
One other quick question. Have you had a chance to sort of step back and think a little bit about the economic impact this is having on the colleges? And obviously students are either choosing not to enroll or choosing not to use dormitories or either scaling back their interest anyway for now. What kind of impact is that having on the system?
Right, that is a challenge, I will tell you. So if you think about economic impact, so going to single rooms versus doubles, for us, that had an impact. And then our president and the president of St. Mary's and the president at Southeast are going to be presenting to the Winona City Council to talk about, what the impact is of wanting students to be cautious on the city and the businesses, right? And so I think that everything is connected. There is a ripple effect. We're not going to know what the full economic impact of this is for probably a year. And so we are keeping an eye on that because nobody has spare budget, I can tell you that.
Yes. Well, it'll certainly have an impact. Well, I think our time is kind of running out, and I want to thank you, Janine, for a great presentation. Really tied in with last week's discussion from Dr. Poland. It really gives us a good perspective on what's going on out there, and we want to thank you. As you, I believe you know, we have an honorarium that we provide for all our presenters, and this year we've identified 5 potential local organizations to give money to in your name, and those are I wrote it down here. Okay, the Public Library, the Boys and Girls Club, the Jeremiah Program, First Steps, or Cradle to Career. And Elizabeth will contact you after and give you a little chance to think about that, and we appreciate your program. Anything in closing? Elizabeth, are you still on?
I am still on. No additional comments.
Okay. Well, I think our time is up, so I'm going to close it down for this week. Hopefully, everyone has a good week, and if you get a chance and are interested in the Rotary After Hours, please sign up for that on our website. And if not, we'll see you at our first midday meeting in August, which will be, I believe, help me out here, the 10th or 11th, something like that. So as we adjourn, go and serve, and remember, Rotary opens opportunities. Thank you.